Most men over 60 are taking the wrong pill for erectile dysfunction. And the scary part? Their doctor prescribed it. Not because the doctor made a mistake, but because most doctors give you whichever one they're most familiar with, without asking the right questions first. And when you take the wrong one, it doesn't just fail to work, it can make you feel dizzy, it can interfere with your blood pressure, it can catch you off guard at the worst possible moment, and make the problem feel even bigger than it already is. So let's be direct. Viagra and Cialis are not the same thing. Sildenafil and tadalafil are not interchangeable. They work differently inside your body. They last for different amounts of time. They interact with food and other medications in completely different ways. And for men over 60, men with real health histories, real medications, real routines, those differences matter a lot more than most people realize. Here's the question you need to answer today. Which one is actually right for your body, your lifestyle, and your health at 60? That answer could change everything. I am Dr. Natalia de la Cruz, and if you want to keep receiving important content about health after 60, subscribe to the channel and turn on the notification bell. Now, let's get back to this, because this is where most men are quietly making a mistake that's costing them results, confidence, and in some cases, their safety. The first thing you need to understand is how an erection actually happens. Because if you don't understand the process, you can't understand why these medications work, and why one might work better for you than the other. When you feel something that excites you, your brain sends a signal that causes your body to release nitric oxide. Think of nitric oxide as the ignition switch. It starts the whole engine. Once nitric oxide is released, your body produces a chemical messenger called cGMP. That messenger tells the smooth muscles inside your penis to relax. When those muscles relax, blood flows in. At the same time, the veins that normally drain blood out get compressed, creating a seal that keeps the erection firm. Your body also produces an enzyme called PDE5, whose job is to break down cGMP. When cGMP breaks down, the muscles tighten again, blood drains out, and the erection ends. This is where Viagra and Cialis come in. Both block PDE5. They stop cGMP from breaking down too quickly. Blood stays in, muscles stay relaxed. But here's what's critical. Neither of these medications creates an erection on their own. You still need arousal. You still need that nitric oxide signal first. Without it, the medication does nothing. A lot of men over 60 take the pill, sit on the couch, and wonder why nothing is happening. The medication is not a button. It's support for a process that still has to begin naturally. Now let's talk about the two medications directly. And let's start with sildenafil, the original, the one that was accidentally discovered. In the early 1990s, a pharmaceutical company was testing a drug for high blood pressure. It wasn't working for blood pressure, but the men in the trial started reporting something unexpected: stronger, firmer erections. That accidental discovery became Viagra. It's been in use since 1998, giving us over 25 years of safety and efficacy data. So how does sildenafil work in practice? You take it 30 to 60 minutes before sexual activity, on an empty stomach or with a very light meal. This part is critical for men over 60, because most of us aren't eating light meals. If you eat a heavy, fatty meal before taking sildenafil, the fat slows down absorption significantly. The medication takes longer to kick in, the effect may be weaker, and you may end up thinking the pill didn't work, when in reality, your dinner got in the way. The effective window for sildenafil is about 4 hours. That means once you take it, you have roughly a 4-hour window where the medication is actively supporting erections. After that window, the drug has mostly cleared your system. Sildenafil is available in doses of 25 milligrams, 50 milligrams, and 100 milligrams. Most men start at 50 milligrams, but for men over 60, especially those on other medications or with certain health conditions, starting lower is often the smarter move. One important thing about sildenafil: it is only available as an on-demand medication. You take it when you need it. There is no daily low-dose version. This is different from tadalafil, and we'll get to that in a moment. The side effects most commonly associated with sildenafil include headaches, flushing, nasal congestion, and indigestion. These are generally mild and pass within a few hours, but there are two side effects that are specific to sildenafil, effects you won't typically see with tadalafil. The first is a bluish-green tint to vision, or difficulty distinguishing between blue and green colors. It sounds minor, but if you're driving, operating machinery, or just going about your day, this visual disturbance can be disorienting. If this happens to you, stop taking the medication and speak to your doctor immediately. The second sildenafil-specific side effect is nosebleeds. It doesn't happen to most men, but it does happen to some. And for men on blood thinners, which is a significant portion of men over 60, this is something worth discussing with your doctor before you start. Now let's talk about tadalafil, Cialis. Tadalafil was approved in 2003, about 5 years after sildenafil. It works by the same mechanism, blocking PDE5, preventing cGMP from breaking down. But the way it behaves in your body is dramatically different. Here's the big one. Tadalafil stays active in your bloodstream for up to 36 hours. Let that sink in, 36 hours. Compared to sildenafil's 4 hours, that's an entirely different kind of medication in terms of lifestyle flexibility. What does that mean in practice? It means you can take tadalafil Friday evening and still have full support Saturday night. It means you don't have to plan around a narrow window. It means spontaneity, something that can feel almost impossible when you're managing medications, meals, and timing. For men over 60 who want to feel less like they're managing a condition and more like they're just living their lives, this longer window changes the dynamic significantly. Tadalafil is available in on-demand doses of 5, 10, and 20 milligrams. Yes, the numbers are smaller than sildenafil, but that does not mean it's weaker. The drugs simply work at different concentrations. This is a point of confusion for a lot of men. So let's be clear. A 20 mg dose of tadalafil is not weaker than a 100 mg dose of sildenafil. They are different compounds with different potency profiles. Here's what makes tadalafil unique beyond the long window. Tadalafil is also available in a low daily dose, typically 2.5 milliliters or 5 milliliters per day. When you take this daily low dose, you essentially maintain a constant low level of the medication in your bloodstream at all times. That means no planning, no timing, no worrying about what you ate for dinner. For many men, this is the version they prefer, because it removes the psychological pressure of scheduling intimacy. And that pressure, the stress of timing a pill, wondering if you waited the right amount of time, worrying whether the food you ate will affect it, is itself a barrier to intimacy. Reducing that pressure matters. But there's something else about the daily low-dose tadalafil that almost never gets talked about in mainstream conversations. It's also an FDA-approved treatment for benign prostatic hyperplasia, BPH. This matters enormously for men over 60. BPH is the non-cancerous enlargement of the prostate that affects the majority of men over 60. The symptoms are familiar. Waking up 2 or 3 times a night to urinate, a weak stream, the feeling you never fully emptied your bladder, sudden urgency, frequent trips throughout the day. These symptoms disrupt sleep, increase fatigue, and compound into real quality of life damage over time. If you're dealing with both erectile dysfunction and BPH symptoms, and many men over 60 are dealing with both, daily low-dose tadalafil may be the only medication you need for both problems. 1 pill, 2 problems addressed. This is also a good moment to remind you about something important. If you're managing your health after 60 and you want to make sure you're not making the silent mistakes that damage the prostate over time, there is a medical guide to avoid the mistakes that damage the prostate after 60 available in the pinned comment below the video. It's there to support what you're learning here and to give you something practical and clear to keep. Now, back to the comparison. There's a question worth asking. Do men actually prefer one over the other? Yes, and we have research on it. A meta-analysis that combined data from 16 studies with more than 5,000 patients looked specifically at head-to-head comparisons between sildenafil and tadalafil. Large sample, meaningful data. What did they find? Efficacy was nearly identical between the two medications. About 60 to 80% of men responded positively to either drug. So if you're simply asking which one works better for erections, the honest answer is they're roughly equal. But here's where the real difference showed up. Men taking tadalafil reported higher satisfaction with their treatment. They reported better self-esteem in their relationships. They were more likely to continue using the medication consistently over time. And in 9 out of 9 studies that directly asked for preference, both the men and their partners preferred tadalafil over sildenafil. 9 out of 9. That's not a small signal, that's a pattern. Why the preference? Flexibility, the longer window, the daily option that removes the pressure of timing entirely. And when that pressure is gone, something else happens. Men feel less anxious. They feel less like they're managing a medical condition and more like they're just living their lives. That psychological shift is real, and it affects outcomes. Now let's talk about what you actually need to know about safety, because this part is not optional, and it's especially important for men over 60. Both sildenafil and tadalafil share the same group of side effects: headaches, flushing, stuffy nose, and upset stomach. These are common, usually mild, and tend to decrease as your body adjusts to the medication. But there are serious interactions you must know about. The most dangerous one is nitrates. If you take any medication containing nitrates, the most common being nitroglycerin, often prescribed for chest pain or angina, you cannot take either of these medications. Not one, not the other. Neither. Why? Because both nitrates and these ED medications lower blood pressure. Separately, each is manageable. Together, they can drop your blood pressure to dangerously low levels, fast. We're talking about a situation that can become life-threatening. For men over 60, this is not a theoretical concern. Cardiovascular disease is common. Many men in this age group have chest pain conditions. Many are on nitrates. If you are one of them, please talk to your cardiologist before pursuing any ED medication. Other medications can also interact. Certain antibiotics, antifungals, and some HIV medications can affect how these drugs are processed in your body, raising the concentration to potentially unsafe levels. If you have kidney or liver issues, your dosage may need to be adjusted significantly. This is not a decision to make based on a YouTube video alone. I can give you information. Your doctor gives you personalized guidance based on your full medical picture. There are also 2 rare but serious side effects that every man should know about. The first is priapism, an erection lasting more than 4 hours. This sounds like it might not be a problem. It is a medical emergency. After 4 hours, the lack of proper circulation begins damaging tissue inside the penis, damage that can be permanent. If this ever happens, go to the emergency room immediately. Priapism is extremely rare when these medications are taken correctly. It's mostly associated with taking too much. Follow your prescribed dose. The second rare side effect is sudden hearing loss. It has been reported, though exceptionally uncommon. If you notice any sudden change in hearing after starting one of these medications, contact your doctor right away. One more thing on safety: supplements. Many over-the-counter products claiming to support erectile function secretly contain unlisted pharmaceutical ingredients, including sildenafil or tadalafil at unknown doses. For a man over 60 on cardiovascular medications, that's genuinely dangerous. If you want these medications, get a real prescription. The generic versions are widely available and far more affordable than the brand name versions. Don't gamble with unregulated products when the real thing is accessible. Now let's bring this together and answer the real question. Which one is right for you? If you have BPH symptoms, the nighttime urination, the weak stream, the urgency, daily low-dose tadalafil is likely the strongest choice. It addresses both issues with one medication taken once a day. If you want maximum flexibility and the ability to have multiple encounters over a weekend without retiming your medication, tadalafil's 36-hour window makes it the clear winner. If you prefer a spontaneous lifestyle without having to think about pill timing at all, the daily low-dose tadalafil eliminates the planning entirely. If you have significant erectile dysfunction, meaning you have very few or no spontaneous erections at all. Some research suggests tadalafil may provide stronger benefit for men in this category. If you prefer an on-demand approach and want the option with the longest clinical history, sildenafil has been studied for over 25 years and remains highly effective. Just make sure that if you choose sildenafil, you keep your meals light on the days you plan to use it. A heavy, fatty dinner is one of the most common reasons men report that sildenafil stopped working. It didn't stop working. The cheeseburger slowed it down. And whichever medication you choose, if it doesn't work the first time, don't give up. It doesn't work every time for every man on the first attempt. Timing, stress, anxiety, and alcohol can all interfere. Give it a fair trial of several uses before deciding it isn't working for you. If you try one and it genuinely doesn't respond, the other may work differently for your biology. It happens. The two medications are similar, but not identical in how they interact with different bodies. Here's the bottom line. Most men over 60 dealing with erectile dysfunction aren't getting the full picture. They're handed a prescription, given minimal explanation, and left to figure it out alone. When it doesn't go perfectly, they quietly give up. These medications are highly effective. The research is clear. The vast majority of men who use them correctly see real results. The key is making sure you're using the right one, and using it right. Sildenafil and tadalafil are not the same. Your health history, your lifestyle, your medications, your prostate, your routine, all of this factors into which one makes sense for you. That's a conversation worth having with your doctor. Go in informed. Ask specifically about the daily low-dose option. Ask about interactions with your current medications. Ask whether your BPH symptoms could be addressed at the same time. You deserve clear answers, not a rushed appointment where someone hands you a sample and sends you home. If this video helped you understand something you didn't before, that's exactly why this channel exists. Health after 60 doesn't have to be a list of limitations. It can be a time when you finally have the knowledge to take care of yourself the right way. If you haven't subscribed yet, do it now. New videos go up regularly on the topics that matter most for men at this stage of life. The things your doctor doesn't always have time to fully explain, delivered clearly and without the jargon. Take care of yourself, because you're worth it.